Good afternoon and welcome to yet another exciting edition of Dr. IMG. I know a lot of you have been asking questions like, how do you become a physician in Canada? How can you practice in Canada without actually going through residency? In this video, I'm going to break down this very infamous or not very well-known pathway to become a physician in Canada, the requirements and everything that you need to know, including the compensation and the kind of work you would do, because you actually hold the title of a doctor in Canada. And I want to guarantee you that you can get this job within 6 months of landing in Canada as a foreign trained physician. If you're interested in this video, please you want to watch right now to the end. Let's dive really deep. So I'm going to take you right here on my screen, becoming an associate physician in Alberta, particularly. In subsequent videos, we'll then talk about how to become an associate physician in BC, in Ontario, in Manitoba. I'll be able to give you all this detailed information. And that is verifiable as well online, and you can call the different health regulatory bodies in this different jurisdiction to get detailed and tailored information to your specific condition. Well, actually become an associate physician and you hold a license from the College of Physicians and Surgeons of that particular province and jurisdiction. So this is really an exciting one. It gives you recency, it gives you Canadian experience, it gives you clinical experience, which are really key tools in matching into residency, as you would see. And this is a very creative pathway as well, because the pay package is pretty comprehensive and really good. We'll cover eligibility and other stuff within the scope of this video. So the role of an associate physician is multi-pronged, and an associate physician has lots of things that they have to do. First of all, they have to provide medical care, and medical care means that they are providing comprehensive package to the patients, which would include physical exams, taking patient history, developing detailed evidence-based treatment options for particular patients depending on where they're hired and what unit they're working on, and making sure that they have their supervising physicians included in making these decisions about this patient. Of course, the next thing would be to document in chart. Alberta has a common electronic medical records that is used by the entire province from north to south, and this really makes things easy both for patients and for physicians and allied healthcare professionals. As a physician, you have access to Epic and Encore, and even as a patient, you have access to see your medical record, and if you make any changes to your medical record, your physician can see it, and your nurses or the people who are within your circle of care can see it. So again, as an associate physician, you have to do documentation, and documentation will mean that you're meticulously including patient information in their record in an orderly manner. You're interacting with patients. Once you get their history, you record it in their record. You're including progress notes, you're including treatment plans, and you're including any others. If there's any request that has been made, in prescription medications that have been prescribed, any stop on any medication, then you want to include it in the patient's file, and you want to maintain that file, and you have to let it be accurate, up to date, and adhering to all guidelines according to Alberta Health Services. The next thing is that as an associate physician, really fun fact, you get hands-on experience, which means you actually go in there and you carry out interventions, and you perform medical interventions or within your scope of practice, and sometimes under the direction of your supervising physician who is there to help you and to guide you perform those tasks well without error. But once again, confident in you and know that you're able to perform those tasks, then they can let you to do it. I have been able to hold this role myself, and so I can speak to it. Before I continue sharing this information, our records show that more than 80% are not subscribed. Please take some time just to hit subscribe. It tremendously helps the channel grow. It helps the algorithm to be able to recommend our videos to a lot more healthcare professionals around the world who are looking to practice in North America and particularly Canada. And it is free to you. It's at no cost to you, but tremendously it helps us. So please take the time to hit subscribe. My promise to you is I'll do a more in-depth research. I'll be able to answer all your questions in the comment sections, and I'll be able to go live on the screen to show you exactly a demo on how some of these processes are done so that you don't make errors when it comes to your turn. All right. Thank you so much for hitting subscribe. Let's get back to the video. As part of the roles of the associate physician, it involves patient communication. Patient communication is really important, and communication is active and passive at the same time. So you as an associate physician, because you have the title of a doctor, it's your responsibility to build a strong patient and doctor relationship. So you have to actively listen to the patient, you're empathetic with them, you have to communicate in a language that's relatable to the patient that they understand, and you have to make sure that your patient can tell you back what they have learned in their own words. And not only the patient, you have to equally communicate with their family. And now you also have to do some data interpretation. So once you've ordered some lab tests for a patient, or say a scan or MRI, of course, the radiologist will give you this information, but the laboratory, biochemistry that you've ordered for a patient, you have to interpret these results and take action based on that. So analyzing patient data and including lab results and imaging studies in their record is a part of the duty of an associate physician, which are actually duties that are done by regular physicians, residents, and fellows on a daily basis. And then you also have to be a part of a team, work collaboratively with a team involving collaborating with allied healthcare professional, nurses, administrative staff, and of course the whole entire physician team, ranging from medical students to residents to fellows and then to attendings and to other department staff as well. All of this is really important. Now, let's start getting nitty-gritty to the things that are really sweet. So for you to become an associate physician, there's a couple of things. I'll try to summarize it into, let me say, three different things. First thing is you have to be eligible to work in Canada. So you have to be a permanent resident, citizen, or have a work permit. Number two is that you need to have passed MCCQE 1, and then you need to have your medical credentials source verified, including your transcripts, through physiciansupply.ca. And then you would have to do something we call a pre-screening that we'll soon talk about it now. You would submit some documents to Alberta Health Services, because you cannot just land in Canada and you apply to become an associate physician. No, you have to have a status that permits you to work. Number two, you have to write and pass the MCCQE Part 1. And if you want to know my blueprint on how I ace the MCCQE Part 1, you want to watch this video right here where I talked about, the different steps on how to ace your MCCQE Part 1. And now, after you've passed that exams, then you can apply for something they call a pre-screening. So the first of all, see if you meet all basic requirements, which involve passing, having documents source verified by physiciansupply. And if you don't know how, if you're thinking of how to create an account with physiciansupply.ca, you look at this video here where I detail how you can create an account through Physiciansupply. The fees might have changed right now because this video was done a while ago, so you check on the fees on the official website. And then you get source verified, you register for these exams, you clear the exams, and then you're ready to apply. You also need language proficiency. It could be IELTS, OET, CELPIP. Each of these exams, and you need to have a minimum passing score of band 7 in IELTS, band 9 CELPIP, and OET. They have their own marking grade. You want to check on the official websites to see what the passing scores will look like. And then after that, once you've gotten that position, then you have to deal with the College of Physicians. And again, I'm going to go into detail. So let's dive into eligibility requirements for you to become an associate physician. So again, you need to have the work permit, which is really important, and I have gone into detail. Your medical school have to be recognized by the World Directory of Medical Schools. So this is how you do it. You go on Google and you type World Directory of Medical Education, WODM, and then you get in there. You have to be able to see your education. So you check here, you can just write your city or your town, and then your school is going to come out, and then you check if it's there or not. If it's not there, then you might not be eligible. If it's there, you have to look at the notes as well, just to see if your school is eligible. If it's not there, then you might not be eligible to apply to become an associate physician in Canada. So you want to check all of this out. And anyhow, we're here to help you, and you can check some of these details on our website. Now, you need clinical experience as well. So you need to have been done with your MBBS or your MD degree, or however you call it in your home country. And then once you have that, you need to provide evidence, because again, it has to be source verified through Physiciansupply, and your transcripts will have to be source verified. So again, for clinical experience, you need to provide evidence of being, in a discipline-specific postgraduate training, or in a discipline-specific independent practice. So either you're in a postgraduate training, you're doing residency somewhere, or you're doing independent practice. And you need to show recency. So you have to show that in the last 3 years, you've either been in residency or you've been actively working as a clinician. And at the time of application of this pre-screening, you have to show that in the last 6 months, you were active. Again, this is really very important. So this experience must be recent and relevant with a minimum of 6 months within the last 3 years. There's also language requirements that you need to meet. Of course, I've already said IELTS, OET, and CELPIP. And again, test results must be current within 24 hours and not expiring within 3 months of the application closing date. So that is how it is. So you must do all this pre-screening and get a pre-screening letter. It might sound hectic, but believe me, it is not. You can do all of this within 4 months and you'd be at a job. So this is really very crucial. Once you get this pre-screening letter, only then can you go on the official website to apply for this job. This is a case particular for Alberta, for the province of Alberta. In other jurisdictions, when we'll talk about it in other videos, you would definitely see that it's different in terms of how you can get a license prior to even applying. Once you get your pre-screening, you go to the Alberta Health Services official website, apply for a job, get a job offer, go for an interview, pass the interview, and then they give you the permission. They don't actually send your information to the College of Physicians and Surgeons of Alberta. So Alberta Health Services will send you information to College of Physicians and Surgeons of Alberta, and then College of Physicians and Surgeons of Alberta will send you an email, and then you can go on their official website, submit the requesting documents that they're asking for, and then you'll get your partial license. So that's how the process actually works. So once you're done with your pre-screening, you've gotten your pre-screening letter, the next thing you have to do is you have to actually apply for that particular job, and you apply for that job on Alberta Health Services portal. As you can see right here on your screen, you can come here, look for associate physician jobs, get into the system, pick a job, look at it, and then you apply for it. Once you apply for it, you wait when the due date is done. If you get an interview, then you go for the interview. Usually on the interview, they can ask you about 2 or 3 clinical scenario questions, and then they can also ask you situational judgmental questions or personal questions, behavioral questions like, tell me about yourself. It's an interview question you literally get anywhere, so you want to be able to have a good story that you want to tell, and always tie the story to how that story has made you ready to be able to take on that position. So tell me about yourself. There can be a battery of many other questions, such as tell me about a time you had a conflict with a colleague. How did you do? What did you learn? Tell me about a time, where you failed. Tell me about your strengths. What are your biggest weaknesses? You always want to tie this one, make them to be solid and to tie with really that particular job position and show how good you're a candidate, because many people are applying for these positions, and so you want to really stand out. And then the next thing they will ask you can be a clinical scenario. They can tell you, you're in their marriage, and then you have a 20-year-old young man who is just coming with an accident, and he's bleeding profusely. He's bleeding profusely and he's bleeding rapidly. What would be your next step? So again, it's like a typical OSCE station. Take a history, everything that you would do ideal when you're taking your history right up to physical exams, and then management. You'll be able to tell that, make sure you're systematic, you're organized, you're giving lots of differential diagnoses when you reach your level of differential diagnosis. The physician that's on that interview might ask you follow-up questions. They're usually easy things. They're not hard, to be honest. And so just a little preparation will make you really ready for this particular position. So that'll be it. And once you're done with this interview and you're past the interview, then you get a notification of being successful. Once you've had that notification, yay, good luck. Then the next process will be for you to apply and get registered with the College of Physicians and Surgeons of Alberta. And again, what happens with the College of Physicians and Surgeons of Alberta is that Alberta Health Services, they confirm that they send you, we're happy to give you this. Prior to that even, once you do that interview, if you're selected, usually it's going to be the same day, that same evening. So when I did my interview at about 1 o'clock in the afternoon, and then about 3 o'clock, I got an email saying, oh, we've been happy with you, we've decided to continue with you. And so can you send us 3 emails and phone numbers and positions of referees. So they'll tell you exactly what they want in that email. Usually they want their referee's name, their job title, their position, their cell phone. Doesn't necessarily have to be a physician. It should be someone who has known you for 2 years. They can speak to your character, your behavior, At least you should always have some physician amongst those who can, speak to how good you are in the clinical setting. And then once you submit this to Alberta Health Services is going to reach out to these different referees. These different referees will then respond and fill the form and submit it back to Alberta Health Services. Then once that is done and the feedback that they give is good, Alberta Services is going to reach back to you, tell you that congratulations, we're offering you the position, and please know that the College of Physicians and Surgeons of Alberta is going to reach to you so that you can register to get your license. Then thumbs up, you're on the way to becoming an associate physician. It takes about 24 to 72 hours for you to get that email from the College of Physicians and Surgeons of Alberta. And again, what they ask you is that they ask for a few documents. They want you to share your passing results of the QE1 through your physician supply. They want you to share your certificates again through physician supply, transcript through physician supply. Then they ask you for extra things like your police clearance. So they want to do criminal check, and you will do criminal check in the countries that you've lived in the past 5 years and you've worked there. So ideally they want a criminal check, and then they want a criminal check for Canada. So you reach out to RCMP and you apply online. You apply for vulnerable sector check, and then you'll be able to get your criminal records check. Usually RCMP take about 2 to 4 weeks, or maybe you can extend a little further just depending on the volume of work that they have at the time, but they're one of the fastest in the country. And then they'll give you this criminal report that you can then submit to the College of Physicians or upload on the portal for the College of Physicians through your account. And then depending on your home country, if they're usually slow, you want to reach out to them really early enough. If they're faster, good for you, get it and then upload it, because again, everything is going to depend on that. Usually Alberta Health Services gives you about 2 to 3 months for you to gather all these documents, and depends on how really fast you are in gathering all these necessary documents, because all of these are really important for you to start training. And so you would have to share all these documents with the College of Physicians and Surgeons. One other additional document you will need to share will be your immunization status. And there is a bunch of things that they'll usually want to ask: MMR, hepatitis, tuberculosis, all these things. They want to know that you're immunized, because you're a physician and you'll be taking care of patients, so they don't want any cross contamination, either the patient contaminating you or you contaminating the patient, who are already very vulnerable. So these are all things that you need to take into consideration. And then we've already highlighted interview process and what the selection process actually looks like. And again, this is just a recap where AHS will evaluate all the documents and just make sure that you're okay. And then they'll call you for an interview. And then again, the interview, a little bit clinical and behavioral questions, as I said earlier. Initial compensation: you have a 6 months training period where they have to train you with EPIC, the electronic medical record system, the health facility administration, all of these things that are really important for you to integrate well and work as an associate physician. They train you for ideally 6 months. Within that 6 months, you're receiving a compensation of somewhere around $6,000 for taxes, and then there's other extra benefits that come into it, and sometimes it can go up to $81,000 within the year for that 6 months period. So this is not a 6 month salary, but that is for that period, that amount. Then once you pass your 6 months of probation or training period, then your paycheck automatically goes up to somewhere around the late 90s. And it's a benefit, it can even be up to 100 and more thousand in Canadian dollars. And this is really important. It helps you a lot to take care of yourself, take care of your family. And then once you've worked for a year, so you've worked for, I think, about 24 or 36 months, then again, it's automatic. And the good thing about associate physician is that a boss doesn't have to increase your salary. It's automatic. The system is already automatic that after you've been working as an associate physician for 36 months, then your salary automatically goes up, and it goes up to about 150 or 148-ish. And then you have added benefits which could take the salary to about 184. And then once you've worked as an assistant physician for like 2 or 3 years, then it goes up to about 201,000 Canadian dollars. So you see, it's a very systematic pathway. It's one of those very rare jobs where you don't need Proval to get a salary increase. You just need the time. So the clock is the most important, valuable asset to you with this job. And this is really great. And once you reach this number, then it can only increase based on advantages and some of the things that you do, like added responsibility. This is for people who don't want to go through the residency route pathway to become resident either in family medicine or a subspecialty resident. But if you want to do that, again, start working as an associate physician gives you a lot of clinical experience, which actually count as recency. And Canada is very focused in terms of their residency programs. They look at recency a lot for some programs. And so this will give you a hedge, like an upper hand. And this gives you a lot of benefit in terms of the fact that you can get reference letters from within Canada when you apply for your residency position. And this gives you Canadian experience and Canadian exposure, which we all know online. Everyone is talking Canadian experience, right? So this is really important. This is very similar, of course, to positions such as clinical and surgical assistants, which are other positions. Again, they still go through the same pathway, but again, that way you're mostly focused in assisting or working in surgical sites and surgical centers. And so how is the work environment? Again, it's usually you're in major hospitals. Now you're working in tertiary hospitals, and you're working in the middle of a multidisciplinary team, and there's lots of opportunity for you to mingle, build connections that are meaningful, and also to take part in continuous medical education. This is really very important. And one other crucial requirement that I think I might have forgotten is that as one of the requirements, you need a basic life support provider certificate when you want to become a physician. So, and this you have to renew every year, and you must get it from a heart and stroke approved organization. This is really important. So you want to also think ahead of that, but it's just easy. It's a 4 to 6 hour course, and you write exams the same day, and if you pass it, then you just go. But it's to do CPR. It's essentially sitting a ladder security position and then calling 911 for an emergency. That's really what it is, nothing more. And again, there's opportunity for continuous medical education, taking part in conferences, being a part of a research team. If that's what you're looking at, you have all these added opportunities, same as a physician, same as a resident. And so career aspects and career prospects are many. If you're thinking of working as an independent physician one day through this part, it's just as I explained, you are then able to take the NAC OSCE exams. Again, we'll talk about the NAC OSCE exams in a complete different video, but you're able to do that. And you're able to apply them for residency through CARMS. And then you go through specialized training. You can do fellowships after that, but again, all of those are pathways that can come later on. And yeah, if you've liked this video and you want to know more, I'm going to talk about clinical assistant pathways or associate physician pathways in Manitoba, in British Columbia, and other provinces of Canada, just so that where you're interested in applying to have where you can get first-hand information. Again, it's always good to go back and read on the official website. If you've liked this information, please hit like and subscribe. It's free to you, but it tremendously helps us. Thank you so much, and peace.